I'm Naomi, I'm a physiotherapist. We're all aware of coronavirus, COVID-19, the respiratory illness that's affecting thousands of people around the world. We're all aware of the typical symptoms that people are getting, so mainly coughing, fever, and difficulty breathing. We're also all aware of the government advice to stay home. So whereas we might traditionally be going out to the GP to help manage these symptoms, in order to help protect the NHS and protect ourselves, we're being encouraged to stay home, which means that we're having to deal with these symptoms ourselves. I'm going to show you a few simple breathing exercises and positioning techniques that you can try yourself at home to try and relieve symptoms and try and improve the general efficiency of the way you breathe and the way your lungs work. These can be done at any stage of the disease, so whether you've got mild or severe symptoms, and can even be done if you don't have any symptoms, just as a way of trying to optimise your breathing. Right, so we're going to start by talking about breathing control or diaphragmatic breathing. And the idea is to breathe gently, control the breathing, but using the least effort possible. So we want to get shoulders and neck relaxed, so using pillows to relax the upper part here. So we're just focusing on the diaphragm, which is the big muscle under your lungs here that helps to push out air and make your breathing efficient. So sitting relaxed back in an armchair with a pillow behind you, or if you're in bed upright with some pillows sort of stacked in a sort of wedge shape, so you're nice and relaxed, your shoulders are relaxed, that's the most important thing. Put one hand on your upper chest here, and that hand's going to stay as still as possible, and the other hand goes on your tummy there, just on your lower rib cage. And the idea is your top hand here should stay pretty still during the exercise, and you should just gently feel this hand here rising and falling as you take a breath. So get comfortable, get relaxed, deep breath in through your nose, and you'll feel that hand pushing away from your stomach, and then slowly breathe out through your mouth. Again, in through your nose and out through your mouth. The idea is really to slow down your breathing, try and relax you. It's used very commonly during yoga, meditation, as a way of feeling conscious about your breathing, but as well as calming it down. It's really good if you're having anxiety. Best thing to do is either sitting or lying, take 5 minutes, quiet time, quiet space. If you're lying in bed, put some pillows under your knees just to get as relaxed as possible, and just hands there, and just feel that lower hand just rising and falling as your diaphragm works. So it's focusing your attention on your diaphragm as a way of controlling your breathing. The important thing is that you're as relaxed as possible up here. So that's breathing control, and the next thing we're going to discuss is called pursed lip breathing. This is a great technique as it allows you to slow down your breathing, giving you more control of the breath you're taking. It can be used anytime you're experiencing breathlessness, especially if you're in the middle of an activity. So if you're in the middle of climbing up the stairs and you begin to feel a bit breathless, that's the time when you can use this technique. So the idea is to have your back supported and your shoulders as relaxed as possible. So if you're sitting, rest your shoulders back in a chair, or if you're standing, find a wall to lean up against just so that your shoulders are fully supported there. And what you're going to do is take a deep breath in through your nose with your mouth closed, and then you're going to breathe out through pursed lips. So it's the same movement with your lips as if you're about to whistle. So that kind of movement. So you're going to take a deep breath in through your nose, and that should take 2 or 3 seconds to inhale in through your nose, and then it should take twice as long to breathe out through your mouth, through those pursed lips. So a couple of seconds breathing in, and then 4 to 6 seconds to breathe out. So in through your nose, and then out through your mouth. Again, in through your nose, and out through your mouth. Use it as a way of trying to slow down and control your breathing when you're feeling breathless. So the last thing we're going to talk about is called ACBT, or the active cycle of breathing technique. It's a series of simple breathing exercises designed to help loosen and clear any secretions that are sitting in your lungs, as well as improve oxygenation. And it includes some elements that we've already done. So the first stage is breathing control. So again, either sitting upright is probably best, get your lungs most upright. Put that hand back on your stomach and just take some nice deep breaths, just feeling that hand rising and falling as you're forcing air into the lower part of your lungs. So 2 or 3 nice deep breaths with some breathing control, as we've previously discussed. The next stage is to take some deep breaths in through your nose, and you're going to hold your breath at the top. So take a deep breath in, relax your shoulders back, take a deep breath in through your nose, and you're going to hold your breath at the top. So in through your nose, hold it for as long as you can, hold it, hold it, hold it. We're going to add a little sniff at the top, so sniff, and then let it all the way out through your mouth, through pursed lips. So we're going to do 3 of those in a row. So again, deep breath in through your nose with a hold and a sniff. Hold, hold, keep holding long as you can. Hold, 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 sniff, and then all the way out, forcing that air out. And then a third one of those. So we don't ever do more than 3 because it can make you a bit dizzy. So third breath in through your nose. Hold your breath at the top, keep holding, hold, 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 at least 5 seconds. Sniff, and all the way out through your mouth. You might feel like you want to cough during this. Try and resist that cough as much as possible till the end of the next stage, which I'll show you. So we do 3 of those deep breaths with the hold in a row, and the idea is to get as much air entry into your lungs as possible. Then you're just going to sit back for a few normal breaths. You can go back to your breathing control for 2 or 3 breaths. Just allow that air to fill up your lungs while we prepare for the third stage, which is the huff, which is where you're going to try and force any secretions that you've just managed to move in your chest up and out. So rather than cough, cough, coughing away, which tends to clear your upper airways, this gets everything moving from the bases of your lungs. You feel it moving up, and eventually it'll be ready to cough out. So the huff goes like this, a medium-sized breath, but this time rather than hold it, you're going to huff it straight out. So the actions is as if you're steaming up a mirror in front of you. So it's a short, sharp huff from the back of your throat. So medium breath in, and straight away, hard and fast, force that air out. And again, it might make you want to, might tickle you, might make you want to cough. Try and resist that, because we're going to do 3 of those huffs. So that was 1. Again, deep breath in and huff out, and then a third one. Deep breath in and huff all the way out. At that point, you might feel quite tired, you might feel a bit dizzy. Sit back, relax, go back to your breathing control, and just try and let your breathing come to normal. You might find that it takes 2 or 3 cycles of this breathing technique to actually get something effective to cough. Or it might be that if you've got a dry cough, there isn't anything to cough up. But it is a really good way to get oxygen into the bottom part of your lungs, rather than just sitting at the top part here, which is what we spoke about at the beginning. So try that. So the 3 deep breaths with a hold and a sniff, and then the 3 huffs out to try and clear whatever's sitting on your lungs there. So there you go, those 3 breathing techniques that you can use to try and control your breathlessness and help manage your breathing. If you're struggling with COVID-19, then it's a good idea to do these exercises 3 or 4 times a day, just to stay on top of your breathing and optimize your lung function. And similarly, if you don't have symptoms, it's actually a good idea to start doing these morning and evening, just to help optimize your lung function, so that if you do develop symptoms, your lungs are going to be in the best place possible to deal with it. Hopefully you're able to follow this video and do the exercises, but if you're still struggling, or if you'd rather have some one-on-one support, please do get in contact. We're currently doing video consultations where we can go through this sort of thing with you. And similarly, if you're struggling with back or neck pain, or any other kind of pains as a result of maybe being in an awkward setup from working from home, or if you've taken up a new sport since the lockdown that you're struggling with, please do get in contact and we'll try and help you as best we can. In the meantime, I hope you're staying safe, looking after yourselves and staying home. Thanks.